أهلا وسهلا بكم في كلية طب الأسنان جامعة دمشق. نسرق الكلمة اللي بيقولها أستاذنا عميد الكلية، هي أقدم الكليات وأجملها في المنطقة. معنا اليوم يوم مميز جدا، تعاون علمي مع جامعة عربية، هي جامعة قناة السويس من جمهورية مصر الشقيقة، مع الأستاذ الدكتور عمر خالد منتصر، هو مدرس مساعد في جامعة قناة السويس بقسم مداواة الأسنان اللبية الاندودونتولوجي endodontic department. تشرف مشكورا بالمشاركة في محاضرة لطلاب الدراسات post graduate students. دكتور عمر خالد منتصر، كل الشكر لمشاركتك، ونحن سعداء جدا بالتعاون مع جامعة عربية. نيابة عن الأستاذ العميد بتشكرك على موافقتك حقيقة، وبكرر أنه نبارك لكم أنه نحل موضوع الباخرة العالقة في القناة، لأنه أنتم حسب ما تحت الهواء كنت عم تحاكيني أنتم كنتوا عم تتابعوا الحدث عن قرب.
طبعا.
تفضل دكتور عمر. طبعا محاضرتك هي بعنوان Rotary Instruments in Endodontics، الأدوات الدوارة في عالم مداواة الأسنان اللبية. بترك الوقت لحضرتك تقدم لنا محاضرة شيقة ومميزة، بنهايتها حيكون في كم سؤال إذا سمحت. We are greatly honored that you are lecturing in our university. Many thanks from the staff and the postgrads for your participation.
شكرا دكتور أنس. وأنا في البداية يعني يسعدني ويشرفني طبعا أكون يعني بنتعاون مع جامعة دمشق في سوريا الشقيقة الحبيبة. و هعمل دلوقتي شير سكرين. تمام. كده الصورة واضحة عند حضرتك؟
نعم، everything is okay، كل شيء واضح دكتور، بإمكانك تبدأ.
تمام. كده ممكن إيه نركز على سلايد شو. تمام. في البداية احنا يعني موضوعنا عن الروتري انسترومنتس، دي حاجة طبعا شيء كلنا بنستخدمه في الديلي براكتس. عايزين نعرف بس شوية كده معلومات وشوية حاجات كلينيكال تيبس كمان عن الروتري انسترومنتس، mainly how to use rotary instruments and how to choose rotary instruments when you're buying. There's too many rotary files in the market right now. Trying to choose can be a little bit confusing. So the outline of our webinar, firstly, we will talk a little bit about the history of root canal instrumentation, the NITI evolution, NITI generations, and what I would like to call secret to rotary safety, some clinical tips and tricks, and guidelines for using rotary files, things to do and things to avoid. Divine is the task to relieve pain, as said by Hippocrates, Abukrat, whose oath is known for all of us med students and dental students. قسم أبوقراط طبعا كلنا عارفينه. Around the world, the best part indeed about being an endodontist is being able to eliminate one of the most painful experiences for our patients. So basically our goal as endodontists is to make root canal treatment procedures less painful and faster without compromising quality, which is very, very critical. Of course, as outlined by Herbert Schilder, root canal cleaning and shaping has mechanical objectives and biological objectives. The mechanical objectives are, as you can see in this radiograph, we should have a continuously tapering funnel from the apex to the axis cavity. Root canal preparation should follow the shape of the original canal. The apical opening should be kept as small as practical, and the apical foramen should remain in its original position. The biological objectives: instruments should be confined to the root canal system, and we should never force the necrotic debris behind or beyond the apical foramen. We should remove all tissue from the root canal space and create sufficient space for intracanal irrigation and medicaments. But we have to realize a very important fact that, as said by Clifford Ruddle, files produce shape, but irrigants clean the root canal system. So mainly, that's why right now, lots of clinicians, lots of endodontists would like to call the procedure not cleaning and shaping, but actually shaping for cleaning. We are enlarging the root canal system to be able to introduce the irrigant to the apical area. Okay, so how large should we enlarge the apical diameter? A debate still in the endodontic community to this day. Lots of research has been done, like this study, for example, where they use different apical preparation sizes to check which size reduce the bacterial load more. As you can see in the conclusion, the increase in the size significantly enhanced the root canal disinfection. Okay, so basically, if you enlarge more to, in this study, they used apical size 30 compared to 35 and 40, and 40 actually had the best bacterial elimination results. Like in this photo, as we can see, because as we know, the radiograph is only a two-dimensional image. This was a root canal treated tooth which failed and was extracted later. As you can see here, the canal was instrumented to a small size. So the clinician didn't remove all the necrotic tissue, as we can see here. There was still necrotic tissue, even if the radiograph was fine looking, but actually biologically, we still had debris and bacteria. So of course, we would conclude from this that, okay, we should enlarge more. Okay, but in a straight canal like this one, it's easy to reach a large apical diameter. Okay, I want to enlarge to 40. Okay, go ahead and do it. It's not going to be a big problem. You can even go to 45, more irrigant, more removal of infected dentin. It's fine. But the real challenge, how could we deal with those cases? As you can see here, curvatures. Of course, as you all know, if we try to enlarge these roots, the apical diameter of these roots to maybe 40, for example, or even more, to produce more cleaning, we will face a great problem. The $1 million question is, in teeth with difficult anatomies, bionic curvatures, S-shaped curvatures, 90-degree curvatures, and all that, how can we enlarge the canal properly without destroying the anatomy, creating ledges, transportation, and even separating instruments? What tools should I use? So we can go back a little bit through the history of instruments used for root canal preparation. Actually, Edward Maynard has been the first one that developed the first endodontic hand instruments, which used piano wires to extirpate the pulp. The idea was very simple back then, that I just remove the pulp and we're done. Which a lot of your patients may have this idea about root canal treatment, that you actually only remove the pulp. يعني حتى ممكن نقول بالعربي انه المريض هيجي لك ويقول لك يا دكتور خلاص كده شلنا او تم التخلص من عصب السنه، اذا root canal treatment is done. دي بتبقى فكره عند بعض المرضى طبعا، وهي فكره بيزك جدا. الموضوع طبعا اعقد من كده بكتير. So of course this approach was not very successful, because later on we knew that it's not about just removing the pulp tissue. We have to clean, we have to shape, we have to irrigate for a high success rate. So just we should leave the piano wires to musicians like Omar Khairat. He's better suited to use these instruments. So we moved on later to carbon steel to manufacture the rotary, the manual files. But carbon steel had disadvantages. It was a stiff material, so the files were stiff, and it was prone to corrosion. So I couldn't actually use it in curved canals. It had high cutting efficiency actually, but it wasn't very helpful in curved and difficult canals. So we moved on to stainless steel, which we all use now in manual files. It was less stiff, so it can actually go into curvatures better. but it was still not that flexible enough to follow the canal curvatures in large sizes. As we know, in small sizes, it's not going to be very difficult to pre-curve the file to follow the canal anatomy, size 10, 15, 20, maybe even 25. But as we go larger, it becomes harder, and there is a high chance of creating ledges and even transportations and even separated instruments. That's why we have since came the NiTi revolution, we have reached the point where there is a material which we can call the smart files because it follows the canal curvatures. Nickel titanium files are formed of nickel titanium alloys, which is 56% weight nickel and 44% weight titanium. Actually, NiTi, to understand it better, we can say that NiTi files, nickel titanium, are just like Batman. Well, how's that? Batman exists in two forms for comic fans here. Batman has, the main character is Bruce Wayne, and the other one, when he wears the mask and fights criminals, is Batman. But the two are the same person. Well, NiTi has two main forms, something called an Austenite form and another called a Martensite form. The alloy can exist in two different forms. The Austenite, we can just say that is like having a stubborn kid. He's not very flexible. He has a higher cutting efficiency, more aggressive. Martensite is like a kind son, more flexible, but has a lower cutting efficiency. The two forms transform to one another via heat or stress. An important term here is something called temperature. As we know, the two forms transfer to each other via heat, which means that there is a certain critical temperature above which the file is an austenitic phase and below which the file is a martensitic phase. Actually, NiTi has passed through many technological advancements, many generations, just like the iPhone here. This was the very first phone, and we have reached more and more technological advances over the years. When you go to the literature to check, all right, I want to know which generations do we have, you will find a lot of classifications. There are classifications which are based on the chronology, files produced in the 90s, then the 2000s, and so on. Some classifications are based on the cross-section, the design, but I believe that one of the best clinically significant studies and research articles, the one here that I'm sharing by the team at St. Joseph University in Lebanon, it classified the files according to the heat treatment, which we get into in a bit. So the first generation files were austenitic files, as we remember, the austenitic phase. So what do I expect from these files? As we said, it has a high cutting efficiency. Of course, they are more flexible than stainless steel, but they had something called, of course, all NiTi files have two characters, something called the shape memory and something called the pseudo-elasticity. When I'm using the austenitic phase, it always has a tendency to go back to its shape. I will elaborate this in a video in 2 slides. Firstly, we have to know that if you go to the market and search for austenitic files, the first generation had examples like these: Lightspeed, Profile, RevoS, and ProTaper Universal. In this video here, it's going to be, we will see how the file is working inside the canal. Okay, it's taking the canal shape. But as we actually zoom in during shaping, you will notice something. you will notice that the file wants to regain its original shape. All right, due to a character in the file, in the night eye alloy, it wants to regain its shape. So when the curve is actually severe, it tries to regain its shape and may tend to form some irregularities in the canal, as you can see here. It may even cause ledges, and it may even cause a bigger problem, which is the problem that we all fear, which is the fractured instruments. Because the Austenitic files want to go back to its original form, when you put it in a lot of stress, when you keep it in the canal for too much time, it can fracture. But first, we have to know, why do files, or how do files fracture actually? There's two main mechanisms. The first one is called torsional fracture or torsional failure. When the file tip becomes locked in the narrow canal while the file shank continues to rotate. And it actually really happens when you try to force a file inside the canal. So this apical part is locked, resulting in separation. The second one is called the cyclic or the flexural fracture or failure, which occurs when you use the file too much. Because when you use the file in a curved canal, the repeated cycles of curving and going back to its original shape, this repeated cycles will cause internal stresses in the file, which ultimately would lead to its fracture. A big problem in rotary files, nickel titanium files, is that when you go back and think, when you use manual files, when you start to use them for too much, or when they are subjected to great forces, you will notice that the flutes of the file start unwinding. This happens in manual stainless steel files. But in rotary files, especially the austenitic type, the first generation, this doesn't happen very much. And unfortunately, you can't really know if a file has been subjected to too much stress or too much use. So it actually might separate without you knowing that you used it before too many times. That's why most of the companies recommend single use. So we had this problem of the austenitic files. It produced high cutting efficiency, but as we talked about, this tendency to get back to its original shape, this austenitic alloy actually caused fracture. And I remember that when I first used rotary instruments in my internship, lots of my colleagues actually were afraid to use rotary instruments. They were the first generation because of the high fracture rate. That's why we reached the second generation, because the night eye is such a blessing. We can just modify some of its characteristics using the secret weapon, which is heat treatment. This photo is from an advert for one of the files, which shows that heat treatment, as we will discuss later, actually improves the file properties. Depending on the thermodynamic treatment of the wires, 3 different wires were produced: R phase, M wire, and CM wire. We will discuss each one. The basic idea is that when you have the alloy and subject it to heat treatment, different temperatures and different cycles of cooling and heating, you gain different properties and different alloy characteristics. One of the first files produced by this heat treatment mechanism was a twisted file. It was in an R phase. So what is the R phase exactly? It's like a mid phase between austenitic and martensitic phases. It has superior mechanical characteristics in terms of flexibility and cutting efficiency. In this video, we can see that in a comparison between the twisted file and the ProTaper file, which is the first generation file, a test was done to check the cyclic fatigue resistance, to check how long will the file keep rotating until it fractures. As we see here, they selected a very sharp 90-degree curvature. They simply rotate the file until it fractured and see how much time did it take. We saw the ProTaper. Now let's see the twisted file. Obviously taking more time inside the canal before it's fractured. Of course, we won't stay this long inside the root canal, but we just, for testing purposes, you can see now that it took like 20.9 seconds to fracture, while the ProTaper fractured in 4 seconds. Moving on to another advantage of the twisted files of the R phase. As you know, K files are manufactured by something called twisting. We have a raw wire, and it's later twisted to form the flutes. While the H files is manufactured by a technique called machine grinding. Okay, what does this have to do with the twisted files? Well, let's try imagining that you had an I-tie wire in an austenitic phase, okay? When you have an austenitic phase and you want to twist it, you will not be able to twist it. Because if you have a wire like that, and you want to twist an austenitic file, because of its shape memory, it will regain its shape every time you try to twist it. You can even try this with the ortho wire. But when you have an R phase, the characteristic features of the R phase is that you can actually twist it. You can actually twist it to form the flutes. So what's the clinical advantage of something like that? Well, the spirals of the files, when the instrument is under too much stress, will tend to unwind, which could provide an advantage for us to know when a file has been subjected to too much stress and it should be discarded like that. They call it a safety feature in the file. But another thing that we have to look into, right until that point, how do you think, how many files do you think we needed to prepare a root canal from start to finish? If we have an example for the ProTaper universal system, for example, first thing you do is to enter a 10K file to do a glide path. Then we could use path files or even manual files to enlarge to size 20. After that, a system like the ProTaper universal, we have to use 3 rotary files, S1, S2, F1, and then 3 more to enlarge the apical diameter. All of that will take time. It will be time consuming. Another companies like Micromega introduced the Revo S system. It reduced the number of files to 3, but still, we are always looking for saving time. Then came a brilliant idea that saved it. The man in the picture below is Dr. Ghassan Yared. He had an idea about using a single file to prepare the canal from start to finish. Well, what did he do? He used the F2 file, and later on, with a twist, he thought that, okay, I want to prepare the canal with an F2 file, ProTaper 25 with a variable taper. Well, how could you do that? He thought about one thing. Going back to the manual files, when you use manual files, you actually use a watch winding motion to cut into dentin better, not full rotation like these files use. So he thought, why couldn't I use this file in a reciprocation motion, which kind of resembles the watch winding motion? And instead of complete rotation, or what we call continuous 360 rotation, he actually used it in reciprocation, clockwise, anti-clockwise, clockwise, anti-clockwise, to prepare the canal. His idea was that when I use this motion, I would be causing less stresses on the file. He actually did that. And as we can see here, instead of using all these files, he just used this file to prepare the canal. But of course, there were some disadvantages. Firstly, that a file like that was an austenitic file, which meant that it has a high fracture rate. It even can cause ledges, as we saw before. So the companies thought about, okay, why don't we improve the alloy using the secret weapon we know, which is heat treatment, to improve the characteristics of the file. As we saw before, with the R phase, Dentsply Tulsa used Ghassaniared's idea and actually improved on it when they introduced the M wire through another kind of heat treatment, cycles of heating and cooling and heating, to obtain a file in a hybrid form. The alloy in the M wire consists of or contains austenite, martensite, and R phase together. So, as we can say, it gains the best of both worlds. It has high cyclic fatigue resistance. Later on, the M wire technology was used in files like ProTaper Next and Reciproc system. And of course, the Wave 1 file, which was the first one to use the same idea of Ghassaniared's research, a file which is kind of similar to the F2 ProTaper file, but used in reciprocation motion, and from a new alloy back then, which was the M wire. So it provided us with high cyclic fatigue resistance, as we can see in this test. This test compared between the same file using, one was austenitic and the other was M wire. As you can see, the stock night eye actually fractured after 46 seconds. Let's see how much time will the M wire take. Remember that both files have exactly the same design, the same taper and everything. The only difference is the alloy, to check which one can resist fracture more, which one can I use more. As you can see, the difference is huge, 4 minutes more. But both these files were used in continuous rotation. Why don't we check actually another mode of motion, which is the reciprocation, the one used in the Wave 1 file. So we had another test like that. And actually the M wire, the same file, but used here in reciprocation motion, clockwise and counterclockwise, to check when will it fracture. It fractured after actually 1 minute more than the M wire in continuous rotation. So to recap, in the second generation, we had new alloys, the R phase, the M wire, and actually also new motion, which was the reciprocation motion. Why did we go through all this? To improve the cyclic fatigue resistance. Okay, but we have another question. In a case like this, we have what we call multi-planar curvatures, and here another curve, and it's a long route, so the file is facing lots of challenges. As you notice, we keep searching for files that save more time, that can better conform to the canal anatomy. Hence came the next step, or the next what we call evolution in rotary nickel titanium technology. If we go back to the year 2010, it had a big event like the World Cup when Spain won the first World Cup. And also for us endodontists, it had a huge breakthrough, which was the discovery of the CM wire. CM means controlled memory wire. Also, it was created by other forms of heat treatment, as we said with the M wire in our phase. But the new thing about this file is, if you go back to the other files, the first generation, it's austenite in room temperature. If you try to bend it, it will go back to its original shape. While this file is martensitic in room temperature. So you can actually recurve it. It's more flexible than the austenite phase. It has high flexibility and cyclic fatigue resistance. It can be actually pre-bent. It can really come in handy when you are dealing with canals that have kind of a limited accessibility. As we can see, High-Flex CM was one of the first files introduced with the CMR technology, also the Fanta files. Here you can see another video, same tests as we have seen in the past slides. Cyclic fatigue test, it took even a longer time to fracture. And here's a clinical tip for you. If you have an austenitic file and you have a canal like in a upper second molar with a distal cavity, which can be hard to insert the file into, especially if the patient have a limited mouth opening. You can pre-bend the CM wire files, okay, but if you have only austenitic files, how can I pre-bend my file? If you try to do it, it will go back to its original shape. But as we know, we can transform between austenitic and martensitic through heat or cooling. So if you cool the austenitic file, it will be transformed to a martensitic structure, and then you can try to bend it. Of course, this is the ethyl chloride, which we use for sensibility testing. You can use it to cool the file, and then you will be able to pre-bend it. Okay, is the second generation the best quality we can get from rotary files? Of course, as we know, advancements keep happening with continuous research. If you look at this photo, it's a photo of a fractured instrument. This is the area of the fracture under scanning electron microscope. Actually, what you see here, these black sites are actually manufacturing defects. The file was had defects inside it through manufacturing. So we have to look into the manufacturing technique. What can we improve to have less degree of fracture? Hence, we moved into the third generation, which was post-machining heat treatment. The heat treatment we talked about in the second generation was done before the machining of the files, before flutes were formed in the files. It was done in the stock NiTi wire with no flutes, and then flutes were created in the file after heat treatment. But another idea was proposed to overcome the machining defects, like the surface voids and irregularities created during the machining. These areas act as areas of stress concentration and crack propagation. So the idea was that we can actually heat the files subjected to heat treatment after the machining. The files you see in the market right now, like the blue files, like the gold files, those files were subjected to post-machining heat treatment to improve its characteristics. As you can see here, ProTaper gold, AF blue, reciproc blue, and Wave 1 gold These colors are produced during the post-machining heat treatment to eliminate surface defects and improve cutting efficiency and also flexibility. Another advancement were the one used in the high-flex EDM file, which was something called the electric discharge machining, which used electric discharges to create the flutes and reduce the surface voids. So after covering these generations, we have to stop here and notice something. All the files we talked about produce a round shape in the canal, as you can see here. But are root canals actually round? Root canals are not round along its length. Actually, maybe the area that is round is the apical third sometimes, but the canal itself, as shown by micro-CT studies in oval canals, from 60 to 70% of the root canal area are left untouched. Can you imagine this? As you can see here in this photo taken by a micro-CT, the green area is not touched by the file, while the red area is actually the one created by you using the rotary file. So can you imagine how much in an oval canal was not touched? In a photo like this, you will even get the idea better. We have, this is the shape created by the rotary instrument. What about this area? It was left unclean. So it can accumulate debris like in this photo, which will also create chances of failure later, because this debris will be full of bacteria. So we have a problem, which is the oval canals. How can we clean and shape them properly with files that have a round cross-section? Hence came another idea, another form of heat-treated files known as the XP Shaper and the XP Finisher. Their alloy is called the max wire alloy, which is the martensite at room temperature. But when it goes into the tooth, into the root canal, it transforms into an austenite form. It actually expands, as we can see here. It's a martensitic phase in room temperature. Size 30, taper 1%. But when it goes into the body temperature, when it's heated into a higher temperature, it becomes austenitic, and as you can see here, it assumes, it expands, it has this form, it's not a straight file, and it actually expands to a 30 taper 4. This is the XP Endo Shaper. This video will demonstrate the idea.
Often when we shape root canals with round files, we end up weakening the teeth we're trying to restore. Because roots are irregularly shaped and our files are round, we're often left choosing between over preparation or under preparation of root canals. The complexity of the root canal system can also lead to accidental file separation. But now there's a solution, the XP Endo Shaper, minimally invasive anatomical root canal cleaning. A revolutionary root canal debridement instrument that gently adapts to the canal's natural anatomy, like a tiny root scaler pulsing within the canal. Traditional NiTi files are susceptible to cyclic and torsional fatigue, so we disperse the stress among multiple files. Traditional files also pack debris apically and laterally because the debris has nowhere to escape. The XP Endo Shaper fixes this because it adapts to the natural shape of the canal in the first place. This means that a single NiTi instrument can clean the entire canal and avoid aggressive dentin removal and debris compaction. It's a revolutionary, minimally invasive anatomic shaping instrument that safely and efficiently cleans the root canal without any of the disadvantages of traditional NiTi instrumentation. You may say, but my current NiTi system works. Well, so does amalgam. It's time to start thinking about making the move to minimally invasive anatomical instrumentation.
All right, as we saw the video here about the XP endoshaper, the whole idea is to deal with such oval irregular canals. That's another video about the XP finisher. Another big advantage of using a file like this one, an expanding file, is the internal resorption cases, as we can see in this video. The biggest challenge with the internal resorption cases is how can you clean this part, this expanding part. It needs an expanding file to be able to touch the walls. And even if you use a calcium hydroxide intercanal medication, all of us know that we kind of face difficulties to try to remove all of it. Even if you irrigate and use your regular rotary files, if you look under a microscope or a magnification with even loops, you can see remnants of calcium hydroxide. As you can see here, an expanding file like that one can touch walls better, which can help you in such cases. So moving on to guidelines for use, we now knew things about, okay, how can I choose the file? How can I choose according to generations when you go to the market, which file to use? Now we want to know how to use the files. Some steps we have to look into. First one is the study. We have to study the preoperative radiograph. Second one is something called the axis karma law, which actually was a term by Dr. Stephen Buchanan. We will go into that. Corroboree flaring, we should not rush to the apex. We should maintain a smooth glide path. We should use the brushing motion, irrigate and recapitulate, and apical gauging. First, we should study the preoperative radiograph. In a case like that one, if it came to your clinic, which file system would you use? Looks like a straightforward case. I can use the first generation Rotary file. But if you have a case like that, with such difficult curve, what do you think would be the best choice? I think we should go with controlled memory files, because we need more flexibility in such case. The access karma law by Stephen Buchanan says that in endodontics, access means destiny. If you try to cheat it, it will come back and haunt you for the rest of the treatment. We have to pay attention to access cavity preparation. We should not rush it, and we should not give it little time. As you can see, there is different proposed shapes of access cavity. You may hear about truss access, ninja access, conservative, ultra conservative. All these access cavity designs can compromise, so not all, but some of them can compromise the shaping. Like this one, if I try to insert a file through such a small opening, how much stress do you think will the file meet? I think it would be a lot. Actually, in a recent review article comparing all sorts of new designs of access cavity, the recommended ones were you can either use the standard conventional access cavity or what's called the conservative, but the ultra conservative and others actually may compromise your shaping procedures. Corroboree flaring is a very, very important step. It can be done with Gates Glidden or the orifice opener file, as in this video shown by Dr. Cliff Ruddle. It eliminates something called the dentinal triangle at the beginning of the canal, which is this part, which can form a lot of stress on the file in the beginning of the root canal treatment. Glide path preparation. Actually, glide path, when you think about it, the first 10 minutes of root canal treatment might be the most important time during your treatment, because in this time, or even more, you are creating a glide path for all the files to follow. What is the glide path? It's a smooth, reproducible path which is created by small files for next files to follow. It's from the canal orifice to the canal foramen. Okay, how can we create this? First, we used manual files. We can use manual files like 10, 15, and 20 to create the glide path. But of course, we faced two disadvantages. The first one, it was time consuming. And the second one, in a severely curved canal, as we know, stainless steel files are not that flexible. So it may actually create a ledge while you are creating a glide path. Maybe when you go to the 20 file, it will start to perform some straightening in the canal. That's why the idea came, why don't we use nickel rotary titanium path files? One of the first files used were the path files by Tulsa, size 13 and 16 and 19 with a taper of 2% to gain the advantages of using nickel titanium with its flexibility. Also, FKG company produced Scout Race files, size 10, 15, and 20 O2 taper. So as we can see, to create a good shape, we have to encounter the same time-consuming problem. We have to use all these files. So naturally, companies thought, okay, how can we save time again? That's when companies started to produce single glide path files like the ProGlider. It's one file with a variable taper. And another file was the 1G file by Micromega, same idea. And the Fanta CPath rotary files, also the HighFlex EDM glide path file. Of course, this reciprocation motion, the idea came later on, and they thought, why shouldn't we use it in glide path preparation also in the file? So wave van Gogh glider was introduced to prepare glide path, and later on our pilots. In this video, we can see that the brushing motion provides a better control and a more safe. Don't force the file when you are trying to go to the length. You can use it in a brushing motion, like we can see in this 3D diagram. You shape the canal gradually. You let the file to enlarge the space to be able to go deeper in the canal step by step. And between each file, each rotary file and the following file, you should irrigate and recapitulate to ensure that you don't have a blockage inside the canal. You don't let the debris buildup increase. So you have finished shaping. How should I choose the master cone size? Which is a common problem I see with a lot of interns nowadays. They buy a certain rotary file system, and the file system last file is 2506 or 3004, and they think that, okay, I have finished the canal preparation with a 3004, then all the canal diameters master files should be 3004. Is that actually right? Of course, it isn't. When you think about it, going back to the manual files, what most of us learned in dental schools, we decide the master file based on the canal diameter. In a large canal, like an upper center, for example, if you shape it with rotary files, of course, you will not, or you should not use a 30 file as your master file. It's very small, not enough cleaning. What you should do is enlarge more. What you should do is something called the apical gauging procedure. When you use a master file, the manual file, which matches the last rotary file you used, to check, does it fit in the canal apex or not? You should put it in the canal and try to force it, try to perform pressure from above. If it passes, if it overextends, of course, then this size is not preferable to use. What to do, what to avoid. As we can see here, that's a sum up of what we talked about. We have to take time to assess the anatomy, to use the best suitable system for the case. You should not use one system for all cases. That's not the case. Even if all companies try to market this, actually, that's not the right thing to do. You should assess the case and see whether the system is better fitted to this case. It's a single case basis. Glide path, ground down sequence, of course, of to perform irrigation, lubrication, and recapitulation between each files. Never force the instruments. Never work in a dry environment. You have to use a lubricant like the EDTA gel. And don't keep the file in a single spot. When you reach the length, you have to withdraw the file immediately. Don't keep it inside. All this time will create more pressure. You have to examine your files for signs of unwinding of the flutes. If this happened, you have to discard the file and you have to clean the files. Well, lastly, I would like to show you a video summing up a root canal shaping of a severely curved canal, including all the principles we have talked about in this presentation. By this, we have reached the end of the presentation. I hope it was useful to all of you, and feel free to ask any question about this topic. Thank you so much.
Many thanks, Dr. Omar, for this informative and deeply detailed lecture.
Thank you.
It was really great details about why we use these files and the generations, and each generation how it is benefit for us and how we can use it. But we have a question about do we need till these days to use generally a one kit of files for let we say 7% or 8% or 800% of the root canals, and repeat the preparation in each canal, or we should really come back to selective diameters and tapers like in the first, before like 20 or 30 years, when we have several diameters, several tapers. Do this situation is stuck to the specialists or for GPs? What's your advice? Because you know that companies usually talk to general practitioner more than to specialists, because they are widespread people and wide platform to work with. What's your vision?
This is a really important topic and question, because as you said, companies are always trying to sell their files, and they market it as, okay, you can use this kit for all canals, for all teeth. The problem is, as we saw in the slide, which I showed earlier, where a tooth was extracted because it failed, the root canal filling was not adapted to the apex well. We should not think of the root canal treatment as we are creating, drawing white lines on x-rays. That's not the case. We should think three-dimensionally. We should think biologically. Because the apical diameter, the apical taper, and apical, actually, it's kind of a debate in the endodontic community, as you know. How much should we enlarge the taper? Now we have files that actually goes into the concept of minimally invasive endodontics, like the new file True Anatomy, which has different, actually smaller tapers. This can show you how really the market is evolving. The same company that produced Pro Taper, which has very large tapers, actually produced True Anatomy, which has smaller tapers. They market it as a file that you can use in ultra-conservative access cavities to enter the root canal easier, because research has showed that pre-cervical dentin is a very critical area. If you enlarge the canal too much, later on we can see the occurrence of vertical root fracture. So I believe that we should use apical gauging. Sorry?
Yeah, especially when we use metal posts as well.
Of course,
when
of
we
course, yes,
enlarge
yes.
the coronal area and the posts, we see
Too much
after 5 years or 6 years we have cracks.
failure.
We have cracks
Yes.
that is different to diagnose, and the failure comes from this cause.
Yes, yes. And if you enlarge the canal to a very large taper, it will actually cause this. So I believe that it's a combination of you have to use maybe a mixture. You have to have a mixture of files at your clinic, different tapers, different diameters, different maybe alloys, and treat each case, diagnose each case separately to see which apical diameter, which taper should you go to. If you have a thin root, you can also use taper 4%. Don't go for 6%. You are weakening this root. If you have a large canal, okay, you can go for 6%. If you have an internal resorption oval canal, you can go for a file like the XP Endo Shaper or XP Endo Finisher to help you clean this over irregular canal. So no, you should not use one single kit for all cases. You should actually diagnose each case and select the files appropriately.
Yeah. Dr. Omar, the next question or the other question, if you don't mind, what is the cut point that we need to use files for cleaning, and where is the cut point that we use irrigation or activation for cleaning? Where's the cleaning demands is
Yes.
for the file, not for the activation irrigation solution?
Yes, yes. Actually, this is a very, very important topic. We can have another webinar in the future about irrigation.
I hope.
Because irrigation is actually the main weapon, the main key to defeating bacteria. Metal doesn't kill microorganisms. Files just shape the canal to allow the irrigant to go in. So that's why the term is now better used. It's shaping for cleaning, not cleaning and shaping. You are shaping the canal to allow the irrigant to go in. And in oval canals, like we have shown, files are not going to clean these areas. 60% are left untouched. What can we do? Even an XP finisher can touch some walls, but the main key here is irrigant activation, is to irrigate and try to activate this irrigant to go into isthmuses, anastomoses, fins, or these areas where bacteria can hide from you and cause failure later. So irrigation is actually the main key here.
Dr. Omar, I really, on behalf of the Dean of our faculty, Professor Osama Japan, we really thank you a lot for this free of charge webinar for our postgraduate students. This is first. Second, I hope if we can get your acceptance, like after 1 or 2 months, that you give another webinar on irrigation. Thanks for this deeply interesting lecture. I was really very happy to watch step by step the thinking and how you build the lecture and how you informed and went deeply in the details. Thank you a lot from Damascus to all our colleagues in Egypt, in your university faculty. Thanks a lot on behalf of all. Thanks a lot. Many thanks. And I hope that we can connect you after 1 or 2 months. And we are now connected with other Syrian universities. So the audience were 5,500 people were watching your lecture. I will send you the report as well. Many thanks. Thanks by my heart for all your efforts.
Thank you so much, Dr. Anas. My pleasure. My pleasure to be with you, and we will meet soon, inshallah.
Inshallah. Bye-bye. Many thanks.
Thanks.